Have you ever looked at your dog and wondered, is this normal? Much like a breast self-examination, which women do monthly, you can check your dog over monthly for lumps and bumps and lymph node enlargement. With lymphoma being one of the most common causes of cancer, especially in certain breeds such as boxers, golden retrievers, Bernese mountain dogs, and several other breeds, and especially seniors of any breed, it benefits us to know what to look for. I'll walk you through this and how to do this when we get back. Hi, I'm Dr. Doty. One of the most common causes of canine cancer is canine lymphoma. 80% of the time, it presents itself because of lymph node enlargement. Most of the time, a pet owner finds the lymph nodes enlarged and brings their pet to the vet. Unfortunately, they detect them when they're really enlarged and their pet is probably already feeling sick. By knowing where to look, you may recognize there's a problem earlier, which would lead to a better outcome for your pet, whether the lymph nodes are enlarged from an infection, inflammation, or a cancer like lymphoma. It's important to remember that you don't know what is abnormal unless you're familiar with what is normal. Lymph nodes are small. Think a jelly belly, a small jelly bean or a pea, and they play a crucial role in our pet's immune system. They can become enlarged due to inflammation or cancer. And here's the good news. If lymphoma is found early, it will lead to a better outcome. This is a dog lymph node chart. It might seem daunting at first, but don't worry. We'll walk through this together and it's here for your reference. I'll go over the 3 that are most commonly found by pet owners. I want to make 3 important points though. Don't worry if you cannot feel the lymph nodes. Just feeling what is normal for the area is enough. Feel with your hands and close your eyes if you need to. Lymph nodes can enlarge for many reasons, from infection to inflammation. These are called reactive, so don't panic. If you find something that seems out of the ordinary, make an appointment and have it checked out. And please, if your pet is not receptive to touch, do not attempt this exam. I don't want you to get hurt. Leave this to your veterinary team. I suggest you find a comfortable spot and a time when your dog or cat is receptive to a belly rub or massage. Maybe when you're sitting on the couch watching TV, you might want to have some treats handy as well. Most important reminder is use a gentle touch. No pokey, no deep pressure, just sliding over their fur and gently moving back and forth to feel the tissues underneath. And be patient. Next time your pet will be more receptive and you can feel a little deeper in the tissue. We are going to first look for the submandibular lymph node. This one is the most common one to be found by pet owners because they're kind of petting their pet and they're like, what is that? And right here at the angle of the jaw, like the back side of the jaw, they call it the angle because it kind of comes down and then it makes a forward turn. So in that kind of area, right, the angle of the jaw, you want to feel in there. And deep in there is the submandibular salivary gland, but in front of that is where the lymph nodes would be. So they would be kind of in this tissue right in front of the angle of the jaw. So normally you're not going to feel those. Just slide around the tissue so that if there's something enlarged, you would feel it. Okay, the next one is the prescapular node. So the scapula is the shoulder blade. It runs right here. So right kind of where the neck meets the spine, the rest of the spine, that's the top of the shoulder blade right here. And then the point of the shoulder's here. So somewhere in the middle, right in the front of the shoulder blade, is a submandibular gland. That's another one that will enlarge and pet owners sometimes feel. Just slide your hands right in front of the shoulder blade. So we're doing a little massage. Again, if you do this a lot, you're feeling here. You'll feel something when it feels different. That's the whole point of this. And then the third one that's sometimes found is back here in the crook of the knee, it's called the popliteal fossa. It's like the backside of your knee is where you would feel another area that sometimes gets enlarged. That's called the popliteal lymph node. And then those are the 3 I'd like to focus on. The cervical nodes, when people have these enlarged, they're along the neck. So just kind of slide along here. So we're going to do our massage. We don't feel anything there, so that's good. And sublumbar, be really, really rare to pick that up, but that's kind of in this area. The lumbar spine kind of underneath here. And then there's one on the cheek called the facial, and it would be like enlarged kind of on the cheek area here. I see that sometimes when dogs have a tooth root abscess. And then you want to get ready for a belly rub for the last two. So we want to feel in the armpits, you know, just slide along the body. Everything feels good. And in the inguinal area, these are the inguinal ones right in here. Just kind of rub the tummy, see if anything feels abnormal, or again in the armpit. So I'm going to show you on another dog. Okay, so she rolled over and I'm feeling her belly and her axillary area. So this is the kind of thing you want to do when you're just loving on your pet and you're watching TV. So the tummy area, that non-haired area on the belly, and the armpit. Again, I'm going to check right behind the angle of the jaw. That's the submandibular, and then the prescap in front of the shoulder blade, and then the popliteal. Dogs don't care for this, behind the knee, right here. Again, don't poke here, just want to feel what's normal. And then the facial one, the sublumbar one, and the cervical one. It's just sliding along the neck. Although you're obviously not a vet and nobody becomes one overnight, this hands-on way to pay attention to what is normal on your dog will help you notice something when it feels different. Keep observing, keep learning, and most importantly, keep loving on your pets. Thank you for watching. Check out our blog where you can find out more information on lymphoma and holistic pet health.